Today is Friday. We always have a Health Friday conversation. And today's conversation is about weight and managing your weight. And if you need to lose your weight, then we get into that conversation of losing your weight. We're joined by two ladies. They are from Nairobi Bariatric Center. The first time I heard of that, I was like, oh, what on earth is that all about?
You know, when you first pronounced it, I heard geriatric.
Yeah,
and, I thought,
and
okay.
theatrics.
And I thought, okay. Yeah, we're not going to discuss old age.
Old age.
Yes.
To make time, and then we talk about
old age on Sabbath
on
day.
Sabbath day.
Okay.
Surely.
Yes.
So, Nairobi Bariatric Center, we're joined by two people. One of them is the Anastasiya Shchukina. She is the operations manager, and Njeri Kubania, who's a nutritionist. Good morning, ladies.
Good morning.
Good morning.
Welcome to Kenya's biggest conversation.
Thank you. Thank you for having us.
That what you're sitting on is the hot seat of the Situation Room. Now we're
Feels
going to
hot.
heat it up because we want to actually understand what you do. We've been hearing about people swallowing balloons and then losing weight. That's how we know this story. You swallow a balloon, you lose weight. So introduce us to the Nairobi Bariatric Center, Anastasiya.
Yes, thank you first for having us. It's a pleasure to be here. We've been around for around 15 years. So you may not have heard of us in the past, but now more and more life is becoming digital, and we understand the power of being in the digital space. So we specialize in weight loss management. So it's not cosmetic. I want to be very clear here that weight management is not cosmetic. It's very much medical, because we look at your body mass, at your waist circumference, at your body fat, and if it deviates from the norm, every step that it deviates above the norm can lead to an exponential number of weight-related diseases. Diabetes is on the rise in Kenya. Obesity is on the rise. There's some studies that show up to over 20% of urban women are either overweight or obese. That's a massive figure. So what we're trying to do is give people the option, either surgical or non-surgical, to tackle and handle their weight. Because we are in the business of improving your quality of life, not cosmetic, improving your quality of life.
Okay. What is cosmetic? Because you keep insisting it's not cosmetic.
Well, something like liposuction, for example, would be cosmetic.
What on earth is
Liposuction.
What's that?
It's when they remove fat surgically, they scrape out the fat under your skin, and so they tone your body. It's like body contouring procedures. So whether it's breast augmentation or liposuction or butt lifts, all these things that you would say, now that's a cosmetic procedure.
Okay.
Yeah, you're contouring the body.
And people pay for these things.
Of course.
What?
Can liposuction not also be a weight management procedure?
As a rule, generally, liposuction can lead to some loss of fat.
Okay.
Yes, so you know, you would hear something like 3 to 4 liters has been removed, right? But it's not a weight management because it's subcutaneous. So that means under the skin.
Yeah.
But a lot of the time, the most dangerous fat actually is visceral fat. That's the fat that's around your organs. How are you going to remove the fat around your heart, around your stomach, around your liver? These are the things that are compressing your internal organs and leading to all the host of medical problems that people are dealing with.
Okay.
So that's the main difference. The cosmetic procedures are really, you see a change physically in
And
terms
many
of
of them are surgical.
shaping. Sorry?
And they're surgical.
They are, but also weight loss procedures can be surgical. So gastric bypass or the gastric sleeve. You must have heard Willis Raburu had his gastric bypass surgery.
He said it
We did
publicly,
it.
yes?
He did it with us, yes. And that was now it's a surgical procedure where we are physically, there's two things we do. It's a restrictive procedure where the size of the stomach is reduced physically, and it's a malabsorptive procedure, meaning the calories that a person is eating are not being absorbed in a regular fashion. So there's less calories absorbed as a person is eating as the food passes through the digestion faster.
But is there not something that you do to circumvent a natural process in order for that to happen that could then be dangerous?
What do you mean a natural
The
process?
malabsorption of where your body would naturally absorb calories or nutrients. Essentially what we're saying now is that you're circumventing that process.
Yes.
Is that...
So yes, I mean, any surgical intervention should always be as a last measure. Okay, anyone who comes to our facility first has to qualify. So they would have had to try to lose weight in the past with diets, with exercises, with other methods, and have failed. And being now in a place where they're facing medical complications, if it's diabetes, high blood pressure, or a BMI over body mass index over 40, that is already considered a very, very problematic state to be in. All right. So what we're trying to do, yes, we are adjusting the way that food is absorbed, where it's not natural anymore necessarily, but any cons that come from a procedure, which may be something like malnutrition, because you'll have to be taking supplements, these cons are far outweighed by having lost weight, gotten to a normal weight, and so you're not in danger of the more deadly diseases that would come with you having extra weight, like diabetes, high blood pressure, risk of strokes, high cholesterol, all these things. So yes, there is definitely pros and cons, but we always say that the pro of having lost weight to begin with is much better, is already setting you up for higher quality of life than anything that would come from the surgery itself.
Okay.
You know, the processes such as the one you mentioned, for it to have been in existence for 15 years, it means the people who consume this particular product. And if 15 years anything to go by, it means there are people who found it useful, the people who benefited from it. But everything that benefits human beings always has an effect that perhaps was not purposed or not intended. These processes that we are here to speak of, what are some of the things that you have witnessed, you have seen happening? This is what you purpose to do, the outcome is good, but something else occurs that you perhaps didn't figure out, and then if indeed such a thing does happen, how do you mitigate?
I like that question because, first of all, we are scientists here, so we don't experiment on people. These processes have been going on. These procedures have been in practice for over 50 years. So the studies on the long-term longevity of these studies is very clear. We don't bring a person into our offices and think, you know what, let's just try XYZ. No, these things are very well established in the medical community. So our procedures are as safe as can be. But as you're asking, there are some risks that are associated with any procedure. So if you're asking about the risks, we can talk about the risks.
There are always risks, and there are always outcomes. That's what I'm calling outcomes that were not intended. And if it is scientific, as you say, every scientific protocol will tell you this.
Right.
That there's a likelihood. We do not know, but there's a likelihood. And you also told, in the event that this happens, then this is how we will go about dealing with it. Now, a scientific process is that detailed. Now, it is this that I'm asking about.
Right.
How do you go about this process? Should something untoward happen?
So the risks of the surgeries, for example, is less than 0.01%.
Okay.
So they're already very low risk to begin with. They're done laparoscopically, meaning there's small incisions that are made in your stomach and a camera is put inside with instruments. So there's no big scar. Risks that could occur can be, say, infection post-surgery, but we monitor the patients in hospital for 2 days post-op. So in case we have had a situation where we had an infection that has occurred post-op, and we catch it the day right after. So the methods that are in place, the structures are in place to monitor our patients and make sure that everything is accounted for. But as of effects that haven't been anticipated is, say, for example, someone post-op has become sugar intolerant. That's an unintended consequence. But as you adjust the way that the food is absorbed, you may find some people they're no longer able to eat sugar at all, whether it's in fruits or it's sugar proper, or they've become lactose tolerant after being lactose intolerant. So the changes in the foods that people are able to take is actually very interesting. They come in with a totally different palate, actually. Even the tongue has changed. Their tastes have changed. So it's an unintended consequence, but it's very interesting for us to observe.
For a process and a procedure that has been there, as you say, for 50 years, the thing that research does, research documents. There must be over time the change such as the one you've mentioned, where the palate, the taste buds do a thing, and suddenly you can't. There's certain things that you enjoyed before, now you can no longer enjoy. Has there been documentation of some commonalities, things that have occurred more often with patients over time? Things that have been seen, changes that patients have, because I guess you could say the changes are unique to every person, and in many cases, as you say, nothing happens. You have the process, the procedure, and you get on with life. But when these anomalies that are unintended occur, have they been recorded, and are there any commonalities, things that you find common? For instance, when you are going to inject someone, say, with a drug during a drug trial, one of the things that you look for is the shock that some people get. Some people, the prick of the needle causes serious trauma for them. Some, it's the sight of the needle, not even the prick. So these are things that have been noticed, so they'll be noticed. And you will be told that you need to watch out for this, because this is what can happen to a patient when this and this process. For the procedure that you've been involved in, are there any such things that you've listed and said, these are the things that we've noted over time with the patients that we've had in the years that this process has been in practice?
Well, it's very important to note that the non-surgical and surgical procedures have different results on the patient's body. So for like the gastric balloon, the non-surgical gastric balloon, you may find that, you know, as the patient has the balloon, they may have some expected side effects that come with the balloon. So that may be, they're not able to eat larger portions. Again, the change of the palate, because the balloon can stomach. We say the balloon stomachs some things and not others. You have to listen to what your balloon wants. So those are expected consequences. The gastric bypass or the sleeve, now these are procedures that are surgical and, you know, I would say, have more consequences that we're watching for. So change in palate may be one, but also maintaining, patients have to be on supplements for the rest of their life.
Wow.
Because, as I said, it's a malabsorptive procedure.
Okay.
So the stomach becomes 150 ml in volume. So it's very small. That's the amount of food you can
Reduced
take at a
from?
As
sitting.
opposed to
1.5 to 3 liters.
so it becomes essentially
It becomes
a
very
tenth,
small.
a tenth
That's
of what
right.
it normally would be.
That's right. So we call it a stomach pouch.
Okay.
So for people who have not been able to lose weight by conventional methods, this is the last resort. This is the option for them, because with these procedures, you'll find, okay, yes, they have to be on supplements for the rest of their life, correct? But we have patients who go into remission from diabetes 2 weeks post-op. Remission. Forever. And as their weight goes down, because it takes up to a year for weight to stabilize, these patients keep reducing weight until they get to a normal weight. They're no longer on their blood pressure meds, no longer taking diabetes shots. So I hear your question, and I understand, you know, you're trying to figure out what are the side effects, what are the risks. And yes, and these are very important questions that we have to talk about. Any medical procedure you step in to do, you have to understand the risks very, very well. But at the end of the day, what I'm trying to communicate here is that the risks with these procedures are far lower than the risks living with obesity.
Actually,
the benefits are...
Yes, the benefits outweigh the risks.
The risks.
Correct.
Yes.
I want to bring in Njeri here. We'll talk about that nutrition and everything. But first of all, so is it true that in this gastric balloon procedure, somebody actually swallows a balloon?
Yes, it's true. We have.
What kind of balloon?
Okay, we have.
Is it inflated or does it inflate when it goes in?
Also like birthday balloons.
There are two types of balloon. One is inserted endoscopically, meaning you're sedated, and it's inserted through your mouth to your stomach and inflated while there. It's a silicone balloon.
Okay.
Yes, and there's the other kind of balloon where you swallow a pill and then it's inflated. You don't have to be sedated for this one. So just swallow it and then inflate it and remove the wire and you're free to go.
Okay. Where exactly does this balloon sit in someone's body? I'm thinking of my body and the balloon. I already have a belly. So now, if we add a balloon to it.
Where are we all accommodating this?
Do you change your trouser size? Waist
Yes.
32 to waist 42.
What? 50? Yes, I'm just thinking. So, where exactly is it nestled in the body?
It's in your stomach.
Oh, right.
Yes, and as she said, the stomach has a capacity of 1.5 to 3 liters, and the balloon is filled to a capacity of 430 to 500 ml.
Mm-hmm.
Yeah, so you don't even really realize you have it outwardly. You can feel it for the first maybe month, but ideally, you don't feel it the whole time.
Okay.
Yes.
So it goes and sits somewhere.
Sit somewhere in your stomach. Yes.
What makes it stop there? What makes it not move lower or come up?
The way it's placed, the position. Yes.
I can also answer that question because there's 2 sphincters as you're coming into the stomach. There's this tight little space like this that it's quite small. So the size of the balloon, it's big enough that it wouldn't go your esophagus.
So there's a non-return valve.
It comes from your stomach through your esophagus, and then there's a little sphincter that it can't pass up or down. Or from the bottom, you also have a sphincter. So top and bottom, you have a sphincter that will keep it in there.
Silicone, you say?
Correct.
Why silicone?
Well, silicone is the material that has been shown to be able to stay in the human body for an extended period of time. The balloon stays for 6 to 8 months. Silicone breasts can be in place for up to 10 years. So silicone is quite well established. I see you laughing.
No, because you're looking at me and telling me silicone breasts are very useful, and I'm thinking, what would I be doing with silicone breasts?
Maybe not yourself, but you may know people who have silicone breasts.
Yes, you may, CT.
Without knowing.
Exactly.
For the last 10 years, CT. Very interesting conversation here, joined by Njeri Kubania, who's a nutritionist at the Nairobi Bariatric Center, and Anastasiya Shchukina, who is the operations manager. So you reduce my stomach to 1/10 of what it naturally is. Obviously, it's going to affect everything else. So you're reducing my intake of food, but food is nutrition. You're a nutritionist. So what does that mean to my body?
So after the procedure, you are put on a special diet to help you manage the effects of the surgery. So this means you won't really be able to eat the way you used to. And I'm talking about both the kind of food you're eating, the amount, and the consistency.
Okay.
Yeah, so for the first month, it's basically a liquid diet.
For the first month?
For the first month after the surgery, and also really after the balloon insertion.
Okay.
Yeah, it's a liquid diet, which is easily digested in the stomach.
Okay.
And easily tolerated in the stomach.
Okay.
Yeah.
But liquid diet here doesn't mean water.
No.
Is it a balanced liquid diet?
Yes. So
it's a special liquid.
let me explain.
Okay.
This is the,
Please.
It's very disturbing. Because I can't eat ugali and I have to drink porridge.
You have to drink ugali.
Yes,
in another
Drink
form,
ugali.
as Njeri is about to explain.
Yes.
Okay, so there's a transition, we call it a transition period.
Yeah.
We move from clear liquids, which basically means anything that you can see through once you put in a glass. These include your broth,
Yeah.
your diluted juices, your teas. And then from there, we move on to a full liquid diet. And this diet is just the normal food you'd eat, but in pureed form. Okay. So you can make a balanced diet.
Like
we recommend
a little baby.
Yes, exactly, like baby food. So you go back to what you used to be fed at 6 months, right?
Okay.
Yeah, so it's balanced. You have your protein. You actually prioritize your protein intake. You have your vegetables in there. You have the right starch in there, all blended into a puree so that you can tolerate it better. So you're still getting the nutrients you need, but in a limited and changed consistency.
Okay.
Okay.
So what is happening in the body at this time because we're still talking about the balloon, right? So what is happening in the body at this time when you've introduced this balloon? So the balloon is sitting in your stomach, right? And then you've changed your diet. You've gone back to the liquid as you would when you were a baby. But what is happening that would then catalyze this weight loss, even as you're, on liquid diet? What's happening that would now bring about the loss of weight?
Okay, so the balloon takes up space in your stomach, which means you won't be able to have as much as you used to before. You come from, as she said, your stomach is elastic, it can expand to accommodate a lot of food. But once you have that placement of the balloon in there, there's only so much you can tolerate. There's only so much you can eat. So the reduction in food definitely puts you on a calorie deficit, which ideally means you are not taking in too much energy for it to be stored in the body as fat. And you're taking in less, which means now your body resorts to using up the stored energy. Your fat reserves now get used because what you're having is less.
So you're introducing a drought in the stomach, in the body.
Yes.
Yeah, I'm seeing a situation where you're constantly hungry.
No, we call it a break from hunger.
So you actually
Because
don't feel hungry.
You don't feel so hungry because you now have the balloon taking up space.
Okay.
So you get full faster with the things that you would normally eat. You just get full faster. You're not as hungry as you would have been in the past.
But feeling of hunger is not a factor of the size of the stomach.
So feeling of hunger
Because you
comes
have a
from,
big stomach, you feel hungry all the time.
Yeah.
well, it comes from the hormones in your stomach,
Right.
so ghrelin.
Yeah.
And where the balloon is sitting is the place where the hormones are being produced.
Okay.
So essentially, we're trying to, the fact that it's sitting there, it's constantly suppressing your appetite. And on top of that, it delays the speed at which the food is evacuated from your stomach.
Okay.
So you would think that if it's normally evacuated, you would have the regular hunger pangs, but because it takes longer for food to leave your stomach, you're feeling fuller for longer.
Okay. So explain to me. So somebody who wants to lose this weight, you have the balloon in, right? You're on this liquid diet for a few days and then for a month, and then now you start to slowly introduce few more solid foods. How do you lose the weight that is already there? Because we're saying suppressing appetite, so that means anything new coming in, you're eating much less of it, but you still have this weight in your body. How does that leave is my question, because the new food is what you're suppressing, isn't it?
It's what you're reducing.
What you're reducing. You're suppressing your appetite from the intake of anything new after the balloon, but you still have, like me now, you still have the weight. Where
will the weight go? And it's not coming out as
It's not
regularly.
coming
You're
out,
not going
exactly.
to the toilet as regularly.
Yeah.
Okay, first we have to understand how you gain weight, right? You
Right.
gain weight by having more than you need. You gain weight by your body absorbing more calories than you need because
Yeah.
you've eaten more.
Yeah.
So your body only uses so much and stores the rest. Yeah, for a rainy day.
Yeah.
Yeah. So now when you reduce how much you're taking in, that means your body needs to make up for it. Your
Yeah.
body still needs the energy. Your body still needs to go on with the daily activities. Your body still needs energy to function, which means it needs to draw that energy from somewhere else. And this is now when your fat stores get used up.
Okay.
So you're not taking enough for you to be able to store extra. You're taking much less. But then there's also your daily calorie goal. There's a goal your body needs in order to function properly.
Yeah.
And that's where it draws from your fat stores now. It tries to use up the stored energy, the one it's stored for a rainy day.
Yes.
That is how you lose the weight.
Okay.
Yes.
Now, there is some benefit in having some kind of storage in your body, isn't it?
Yeah.
And it's a natural bodily
Yeah.
function.
It's a natural bodily function that your
store.
body will want to store some so that you can use it. Energy, those are the things, you know. We say you have some breakfast in the morning because, you know, it kind of wakes you up, it keeps you alive, then you can have your mental, other physiological functions that are necessary. So in this process, what happens? Because if you use your storage, that's essentially what happens. You get leaner, you lose the weight, right? You use up. So where will you then get storage for you to use in the future?
It's a very good question, because we don't need very much storage to use in the future. We're not living in the, in the cave times when we didn't have food. Food is easily available. We don't actually need a lot to store for us to function properly. So the more, there's a normal range within which we need to be in, everybody individually. And if you go above that range, it becomes now unhealthy.
Okay.
So as long as you're within your normal range, which will also have fat. So anybody who's in a normal range should also have some stored fat, but you're still in your normal weight. If you go above it, now that's already when there's too much.
Yes.
But if you go below it, equally, it's too little. Yeah. So whether you're underweight or whether you're overweight, the dangers are the same. You're still in danger.
Okay.
So we're aiming to get you to your normal weight.
Okay.
So you have to do the assessment first.
Of course.
And say, based on your physiology, your weight should be this. So you need to lose 20 kilos, 40 kilos, 35 kilos, whatever.
Correct.
So how then do you manage that to the exact science of 47 kilos that I need to lose? Is it the size of the balloon? Is it the length, the duration of the balloon in my stomach? Or is it the liquids that I take?
That's a very good question, because everything we're doing is a tool. So the balloon is a tool, the surgery is a tool. But the main thing that we have to understand is it starts in the mind, your relationship with food. So for us, we're very keen on rebuilding and recreating a positive, healthy relationship with food. Now, the balloon may allow you to lose maybe 10, 15 kilos. If you need more, if you need to lose more or you need to lose less, that comes down to your food choices. That comes down to how many calories you're intaking during the course of your day. Are you eating chips? Are you choosing to eat KFC? Are you choosing to eat vegetables? So we crave food. Hunger is hardwired into every human being. It's one of the most primal feelings. So how do you kind of square with yourself? How do you understand, this fried food, our body craves it because from the times when we were still living in caves, we were drawing on that fatty food, on that energy, so we can store it, like Njeri was saying, for the rainy day. Yeah. We don't have those rainy days anymore because food is available for us. So we're trying to rewire, re-understand for every individual, why are you making the food choices you're making? That comes down to psychotherapy now, to make you build a new healthy relationship with food.
Okay. I've got a question that's come in on social media. My friend did the balloon thing. Cost him about 500,000 shillings and he actually lost weight. Unfortunately, after the balloon was chomolewed, weight has slowly come back and is back to where he started. What could be the issue here?
Yeah, that's it. That's exactly what I was talking about. The psychological part of your relationship with food. Because if you think you cannot regain weight with the surgery, you're wrong. You can. If you think you will not regain weight with the balloon once the balloon is removed, you may. So ultimately, this is a chance while you have the balloon, it's like an intervention to give you a break from hunger and then to re-examine and relearn your relationship with food so you build habits during this time that you can take with you for the rest of your life so you don't regain the weight. I suspect, and I would be curious to hear from the person who wrote on social media, whether there was a psychotherapy element in the treatment of this person, of their friend, whether they were involved in actually adjusting with a therapist to see, what is their relationship with food.
So it's all about food. Weight is food.
Absolutely.
Nothing else.
Well, exercise, of course, comes into play, but that's now, also it comes down to food because it's all energy.
Okay.
Yeah, weight is all energy. If you take more energy in that you can burn, you'll put on weight. If you take less energy in than you're burning, you'll lose weight. It's mathematical.
Are there any exceptions to weight gain beyond food?
Hormonal.
Yes.
Of course, you have hormonal weight gain. You may have a slow metabolism that can be genetic. So definitely there's... So weight gain is not just one-dimensional where it's only one element or another. There's environmental factors, social factors, but ultimately the mathematical element is it. So hormonal, for example, metabolism is slow, right? But the same mathematical principles apply. You're not burning as much as you're taking in, so you'll put on weight.
So how do you treat those? How do you treat if a bigger contributor to your weight gain is hormonal or physiologically, genetically predisposed to big weight? How do you treat that with a balloon inside you or whatever procedure?
That will come down to the reports from the endocrinologist, which will be reviewed by the surgeon and the whole medical team to review whether this is something that is now, whether there are other interventions that have to be taken into account. But as a rule, generally, it's a whole medical team. Every individual is approached very uniquely. We have to look at your individual medical history and figure out what's best for you. It's not a one-size-fits-all.
Sure. By medical, do we mean what we know of medical to be? Doctors who are trained, gone through med school, have been licensed to operate, nurses and all?
Yes, exactly.
Or are we talking about traditional medicine?
Herbalists.
Herbalists.
No.
People who've acquired the skill over time, passed on generation to generation. So the question then is, of the Kenya Medical Practitioners and Dentists Board that licenses and regulates health professionals and health facilities in Kenya. Do you have a license from KMPD?
Of course we do.
As a what? As a hospital, as a clinic, as a lab? What are you licensed as?
We are currently licensed as a clinic, as a medical facility. Yes. But we could not practice if we did not have a license.
Okay.
Yeah.
Everybody who works at the Nairobi Geriatric Center is
bariatric. We're talking about words. That's a new word to learn. Bariatric is weight loss. Bariatric means weight loss.
Geriatric is the other one.
The one I'm heading to.
Yes. My mother is 77 today, so age is a thing. So listen, everybody, all the doctors and all, are licensed by the board.
Absolutely.
They have a practicing license.
Absolutely.
Everybody that I find in there has a practicing license,
100%.
including Nutritionist Njeri.
Absolutely.
Yes.
Qualified, licensed to operate in this country.
Yes.
Okay. In the regulations and all, do you get visits from the board who come and inspect what you're doing?
Yes, of course. Periodic visits are absolutely, they have to happen, yes.
So this procedure has actually been sanctioned by government?
Yes.
Okay. So then it's recognized as a medical procedure. Are there people who use their medical insurance at your facility?
So it depends on the insurance that people have. Some who have international insurances, because unfortunately in Kenya, the insurance companies have not jumped on that bandwagon. And if you know the journey of medical weight loss in the US, it also took a very long time. And actually for patients to fight with insurance companies to get them to cover these procedures. So we would love for these procedures to be more accessible and more available. That's our goal.
What does insurance, if we want to look at like NHIF today, or any of the other private insurances, because a lot of times when you go in for surgery, and your insurance is going to cover it, they ask you things like pre-existing conditions and all manner of things. So what does insurance in Kenya view these procedures as today that would then either deny you or give you permission to use your insurance to have these procedures? What do they view this procedure as? Cosmetic or medical?
Exactly. So that's the problem, because they view it as cosmetic. And ultimately that's what we need to change, that understanding, because the rest of the world views it as medical. It's covered in most developed countries as a medical procedure that you can qualify for with your insurance, with your government insurance. Here, that's not the case. And that's a conversation that we want more and more insurance companies to start having, because ultimately it costs them more to pay for someone who has a heart attack or who has diabetes than for someone to lose weight and not develop these conditions to begin with.
Why do you think it's so difficult to convince them that this is medical and not cosmetic?
I think it's more bureaucratic red tape. I think it takes time. It took a lot of time in Europe, in North America. It's just something that takes time, but we hope to get there eventually.
Is it because, or maybe could it contribute because it changes the way you look much more than how you function?
I think there's an element to that, but like I said, for us it's not about how you look necessarily, it's about your health, right? So maybe that I think there has to be something there too, because you can see a marked difference in how someone looks post losing weight. So maybe that's also the misconception, that they think it's a cosmetic thing.
Please remember that we come from cultures and communities where having weight was not considered a problem.
Correct.
In fact, it was a positive thing.
Indeed.
That's it.
So now they
Even
change.
till now, so,
yes, no. Predominantly in some communities that I know of, like the one I come from, somebody who has weight it's considered good. It is not bad. So how can this good thing now be bad so that it requires treatment?
Medical intervention.
Yes,
right?
and even then, it's a fanciful thing. You have weight, so you want to lose it. Why do you need a medical insurance for it?
Which brings me to that other question, Anastasiya. You see, the world has really been working hard at communicating differently about weight. You know, going against body shaming, going against all those things, and trying to teach children that, no matter your weight, no matter your size, you're fine. You're good enough. Now, this, with the promotion that you're doing even on social media, you know, I used to be this big, and now look what I've done in the last 1 year. I'm now feeling better. I'm a better version of myself. Are you not getting back into promoting what we were talking about, body shaming? And people feeling that they are not enough because of their body size.
That's a very good question. Body shaming is horrific anytime. We don't want to body shame anybody. But equally, as if someone is severely underweight, they're unhealthy, just the same way anyone who's severely overweight is unhealthy. So you wouldn't walk to someone who's anorexic and say, "Love, oh, you know what? You know, you're normal, you're fine." Why do everyone tell anorexic people, eat food, right? So they can get to a normal weight, because it's unhealthy. It's unhealthy. Just like underweight people lose their periods, they're not fertile, they're not able to have children. Equally, people who have a lot of extra weight have
same problem.
PCOS, they have infertility issues, they're not able to get pregnant. So I'm not talking about body shaming in itself. Body shaming is bad in itself. But here, the conversation is about health. And I feel there's a time when body shaming, it's not body shaming. We have to have a realistic conversation about what is healthy and what isn't.
Okay.
And ultimately, if you have a lot of extra weight, you're unhealthy. That's the bottom line.
In your association, do you have a communications department?
I am the communications department.
Okay. Why is it so expensive? 500,000 shillings to swallow a balloon?
So the endoscopic balloon actually goes for 350,000. The costs associated with these procedures and bariatric surgery is 850,000. So yes, there is a steep cost. The cost associated with the procedures, first of all, is quality, and our doctors themselves, they have to be highly qualified. The tools we're using. All right, we are buying tools from Europe, from North America. These are tools that are now subject to the dollar rates, to the fluctuations. Yes. So definitely, we have a lot of extra associated costs that we try to put down as much as possible, but it's at some point beyond our control. So, yeah, and the technology.
Medical processes are expensive.
Correct.
Yes.
And that's why insurance would come in.
That's precisely.
But that's also where the board, if the board has not clearly categorized this as worthy or not worthy, but as
a medical intervention,
whatever intervention, then insurance will not look at it that way.
That's why I asked about the communication with these people who would be your partners.
But thank you very much, ladies, for joining us. It's been an interesting conversation. It's been a healthy one.
Thank you for having us.
The two ladies are from the Nairobi Bariatric Center. Njeri Kubania is a nutritionist, and Anastasiya Shchukina is the operations manager. Keep it here for more conversations. If you got any questions, how do they find you on social media?
Nairobi Bariatric is our hashtag.
Nairobi Bariatric.
Yes.
Okay. That's it. Get more information from them.
This is the Situation Room, the only way to start your day.